The blue waveform on this digital patient monitor is a familiar sight to pediatricians and other healthcare providers in wealthy countries such as Canada. It's called pulse oximetry, and it provides a continuously updated index of the patient's blood oxygen saturation. It alerts the physician or nurse if the patient has what's called hypoxemia, or a lack of adequate oxygen circulating in the blood. Pulse oximetry is so fundamental to modern pediatric practice that it has been called the fifth vital sign. It provides objective information about the patient's physiologic status, along with the classic vital signs: heart rate, blood pressure, respiratory rate, and body temperature. In this Canadian Grand Challenges submission, we propose to test the idea that pulse oximetry can be used as a triage and clinical assessment tool in first-level health facilities in developing countries to identify the sickest infants in need of urgent medical care. Quantitative measures such as pulse oximetry can play a really important role in the assessment of the youngest infants under 2 months of age, who often present with very subtle signs and symptoms even when they have serious illnesses such as sepsis and meningitis. These are the types of conditions that contribute to the deaths of millions of newborns every year in developing countries, particularly in South Asia and Sub-Saharan Africa. Early recognition of these conditions is crucial to implementing interventions to save lives. Pulse oximetry is a relatively simple technology. It's entirely non-invasive and requires the simple attachment of a light-emitting sensor to the infant. It could even be assessed using inexpensive portable devices. Currently, pulse oximetry is rarely used in developing countries, but we believe that the routine use of pulse oximeters to assess young infants in resource-poor settings may help to save lives. If supported by the Canadian Grand Challenges, that's the idea that we would put to the test.